So, Dr. Hendricks, some patients come in for these little nips and tucks and little adjustments here and there on a consistent level, mainly keeping care of themselves with maintenance. Other friends and families might say to that person, "That is so silly. Why do you keep doing that?" But there really is a good reason and purpose behind that. Can you share with the viewers how powerful and how great results you can get by keeping up that maintenance?
Yes. A couple of things come to mind when we talk about that. You can wait until the bridge is completely crumbled and the street is all cracked and the cables are all rusty, and do a renovation at that point, or you can do little things along the line to maintain it so that they're not so drastic at any one time. It doesn't cause traffic to be totally diverted for months and months and months while the whole bridge is renovated. Take that example and apply it to facial things or body things. There's never a better time than now to really stay young, look younger. You're in the best health you're going to be, presumably at this point. 10 years down the road, you don't know how your health is going to be. I suggest there's never a better time than now to do the things that are possible, that are easy, that you'd like to have done. It is now more and more with maybe people saying, I don't want to have a certain budget. What little things can I do that would make changes? In general, we have a saying in plastic surgery that mini surgery equals mini result. So you have to take that into account. However, I have a great example of, we'll have to add this, see if we can add this into the video. But I take a picture of a gentleman before surgery from the side and paint the scenario that you're at a stoplight and you look over and you only see about that much of a roll down window, maybe about 2 or 3 inches, and you're just seeing about this much of his eyes. And you can see that the eyelid skin is doubled over and it's touching his eyelashes. And I said, you guess the age of that person. Well, most people would say, oh, he's 45, maybe 50, in that neighborhood. And then I take the same picture of him after the surgery and say, okay, you've pulled up to the next stoplight and you look over for a second and you look back. You've already made a judgment about his age just by seeing this much of his eye. And after the extra skin is removed and it's no longer touching the eyelashes, you look and you say, he's 30. And so somebody removing just a few millimeters of skin, so it's not actually touching the eyelashes, and only seeing that part of his eye makes a 10 or 15 year difference in terms of appearance. And it's striking how just looking at one small feature of the face and just dealing with a few millimeters that it's 10 or 15 years difference.